Welcome back, everyone. Okay, many of you can probably tell it is springtime in Central Texas just because of the symptoms you're feeling, and you are not alone. That could include sneezing, itchy or watery eyes. That can often kick in this time of year for people suffering from allergies.
And I know it well. Austin even made the list of the top 50 most challenging places to live with pollen allergies. That's according to a report this year from the Asthma and Allergy Foundation of America. So joining us this afternoon to talk more about how to deal with allergies and fight some of those symptoms is Dr. John Villacis. He's an allergist at St. David's North Austin Medical Center. Doctor, thanks for joining us. We appreciate it.
Hey, thanks for the invite again. Thank you.
Yeah, and I want to just kick off our conversation and say our weather team tracks pollen levels all the time, and you can see live pollen count updates on our website, KXAN.com, so just wanted to cover that first. But doctor, can you talk to us about what do you think it is about Central Texas that makes pollen such an issue here?
Yeah, well, there's something that pollinates every single, throughout the entire year. I mean, during the winter season, we got cedar season. During the spring season, we have the tree season, which is going on right now. And the grass season follows shortly thereafter. We get a little bit of a break during the summer season because it gets so hot here that nothing pollinates. But then we have the fall season, which is the ragweed season. So there's always something pollinating in Central Texas.
I know people at home are probably thinking, okay, what does it look like to get me some help? So what are your suggestions for people suffering and they want to treat some of those symptoms?
Well, number one is just knowing that you have the allergy. So you just mentioned the fact that you guys check the pollen count every single day. I mean, right now you don't even need the pollen count. You see the yellow stuff on the cars on the windowsills right now, and so you know that right now if you go outside, for those that are allergic, you're going to feel symptoms rather quickly. And so a lot of times it's preparing. It's knowing when your season is gonna come, and then also assuring that you're on medications before the season hits.
You mentioned some of those medications there. I think a lot of people at home are wondering, is there something that I can go to the drugstore and pick up over the counter? What would you say is the best way to treat them if they're looking for that kind of option?
Absolutely. So from a medication standpoint, there's a lot of over-the-counter antihistamines, especially the non-sedating antihistamines. This is the Zyrtec, Claritin, Allegra, Xyzal. Those medicines usually are considered non-sedating or low sedating. And then in combination with the nasal spray, such as Flonase or Nasacort or Nasonex, really works well for most patients. And then on top of that, you also do what's called avoidance measures, such as, changing the sheets once a week, you change your filter, take a shower at night. Those things are helpful as well.
I want to know for folks who maybe they have tried the Zyrtec, it's not working for them. Talk to us in your practice. Have you noticed any changes in the number of patients coming in and seeking relief from professionals like yourself? If so, what do you think is driving any changes you're seeing?
Oh yeah, so this last week, we've been seeing a lot of patients coming in, and it has to do just with the pollen count being so high. We've got another maybe 2 to 3 weeks of pretty moderate to moderate high levels, and it's going to start tapering down. But then we have other things that are coming in. But oak has been strong. I mean, you guys have seen it outside. And in reference to, if a patient's taking these medications and not noticing much of a difference, it either means that their allergies are crazy bad. But then I also say to patients that sometimes maybe it's not 100% allergy. You could be dealing with a sinus problem. You could be dealing with other things that kind of look like allergy, but it's not necessarily allergy. But we can help with that. So as an allergist, we can help with those things.
Yeah,
you could definitely help a lot of people out there for sure. Is there anything, doctor, that we didn't touch on in this conversation that you would like to highlight out there and make people more aware of?
Sure, 2 things. I would say that the first is that we're seeing a lot of asthma too. So asthma is many times, especially in kids, closely related to allergy. And so if you hear your child coughing up a storm, wheezing, I mean, they should be seen. So we're seeing a lot of kids having some pretty bad asthma attacks so far this year, or these last couple of weeks, because of this. And the second thing is also eye symptoms. There are, especially in kids, if they start getting a lot of swollen eyes, what we call ropey discharge, really bloodshot eyes when they're outside versus inside, that needs to be seen rather urgently because there can be some permanent damage to eyes, especially in kids during this time of year.
Dr. John Villacis, we appreciate you so much for making time for us, and good luck with your practice there, because I know that it's been a busy time, so we appreciate it.
Yeah, thanks so much for your time as well.